Hey everybody, my name is Paul Thomas and I'm a family medicine doctor, and I wanted to talk to you today about the frequently asked questions that I receive about Plum Health direct primary care. The first question that people have is, what is it? So direct primary care is an alternative payment model in contrast to the fee-for-service system. So in direct primary care, you pay a monthly fee. In my practice, it starts out at $49 for adults. And with that fee, you have access to your doctor. You can call me, text me, email me anytime, and come in and see me at any time. The next question I typically get is, so do I need health insurance? And unequivocally, yes, I recommend that you have health insurance. And just because you have health insurance doesn't mean you have health care. And what I provide is the health care portion. But if you're in a car accident, or you have a heart attack, or you have a stroke, you need to have health insurance so that when you go to the hospital, you're not shocked by a huge bill. You'll probably meet your deductible in that year that you go to the hospital. But I say that I can handle 80 to 90% of your concerns, and the rest I would refer, or in those rare occasions where something catastrophic happens, you need to have insurance. So then the next question I get is there a sign-up fee? No, there's currently not a sign-up fee. You pay your $49 a month and you can use me as your family medicine doctor, and I can provide services for you. Do I see patients of all ages? That's another question that I get. Yes, I do. I'm a family medicine doctor, so I take care of people from a young age to old age and everything in between. The next question I get is, what if something happens and it isn't working out and I want to cancel? That's totally fine. Let me know. We're both adults. Let me know if you want to cancel, and you can cancel at any time. Having a 30-day notice would be nice in either direction. If it's not working out between us, I may have you find another doctor, and I'll give you a 30-day notice about finding someone else in the market who can help you. So another question I get is, what are your prices? So for those adults aged 18 to 39, it's $49 a month. For adults aged 40 to 64, it's $69 a month. And for those aged 65 and above, it's $89 a month. Kids are $10 a piece. But that being said, if you're signing up and your spouse signs up, it's the full price for you, but it's $10 less for your spouse. So if you're both 35, it's $49 for you and $39 for your spouse. And then if you have kids, it's an additional $10 for your kids. I say that I don't want to be less than a cell phone bill for individuals and then less than a cable bill for families. All right, the next question I get is, what medical conditions do you care for? And mostly I take care of anything that you might see in urgent care. So bug bites, sunburns, rashes, coughs and colds, and then anything your family medicine doctor would take care of. Hypertension, diabetes, asthma, eczema, etc. So I really take care of a wide range of conditions, and too many to name here in this video. But if you have a question about it, just give me a call or email me. I'll include my phone and email in the comment section below. Are my medical records ever shared with anyone else? And the answer to that is no. So we use a secure server. It's called Atlas, and your medical records are kept in that server. I don't send them to your insurance company unless you specifically request me to send them there in the case of like an annual physical, if you need to meet some requirement. But no, I don't share your medical records with anyone other than with you. Can I contact you after hours? And absolutely. I'm your doctor, and I'm not just your doctor from 9 to 5. You can call me, text me, email me at any time. Even if it's in the middle of the night, you can call me. You might have to ring me a couple times to wake me up, but I'm more than happy to help you when you need it. What if you need medical care when you're away from home? Again, just call me. If let's say you run out of a medication while you're on vacation, I can call the pharmacy nearest to your hotel or nearest to where you're staying, and I can call that medication in for you. It's no problem. Or if you have a simple medical question when you're traveling, feel free to give me a call. The next question I get is, what about labs and imaging? Like, how much is that going to cost me? Well, I contract with a lab company to get you at-cost laboratory services. So you might pay $150 for a complete blood count at a big hospital, but we can get that test for less than $5. You might pay $125 at a big hospital for a lipid panel, but we can get that lab test for less than $10. Now, these are in addition to your monthly service charge. So if you're paying $49 a month and I do a CBC and a lipid panel, on the next month's bill, you might have a charge for $15. So it would be $65 for the next month versus $50 if you didn't have those tests. But the prices are clear and transparent. In addition, if you need a CT or an MRI, you might pay $3,000 through your insurance, but I would get those tests for you for the market rate, and that price is typically in the $300 to $400 range for CTs and MRIs. And I can give you a full list of pricing on imaging services if you're interested. We can get you an abdominal ultrasound for about $150. Mammography is less than $200, and so on. That's kind of on a case-by-case basis, but I can make those prices clear to you. What if I want to continue my current insurance plan? Definitely continue your insurance plan. I want you to be comfortable with whatever insurance plan that you have. So if you are really loving your Blue Cross Blue Shield Silver plan, keep it. If you're looking to save money and you want to go down to, say, a bronze plan and then use me for all of your day-to-day primary care needs, you may save a little bit of money over the long term. And that's where I can really help you, is if you want to drop down a coverage level but then add me in for your primary care services, you may see yourself saving money over the years. That's it for now. Those are most of the big questions that I get. Please feel free to ask me anything in the comment section below, and I'll do my best to answer any questions that you might have. Thanks so much for talking with me, and I'd love to answer any of your other questions. So thank you again, and have a great night.